So once again, I would just double check that I had documented. It would be the name, date, time, dosage, route, and my initials. And then I would move on to my and then I would move, that would conclude that demonstration. I'm going to move on to my IV piggyback demonstration. I would check my doctor's orders and my MAR, and that I had, and my doctor's orders say that I have an order for 1 milligram of Dilaudid. So I'm going to go ahead and gather my supplies. I'm going to get my syringe here, attach my needle. I'm going to drop 1 milligram because this is 1 milliliter, so it's 1 milligram per milliliter.
Checking the patient for any allergies, looking at the physician's order. This nasogastric insertion will be for suction. Go into my patient room. Hello, my name is Courtney. I'm a nurse today. Please tell me your name and date of birth. Any allergies? Okay, well, I'm going to be inserting.
I'll put this in my sharps container. Go ahead and mix this gently. I then get my tubing ready. And then I would go ahead and put my label on here with the date, the patient's name, the date, the time, the drug, the dosage, and the route. And then I would put my initials on there. And then I'm just going to prime the tubing. Oh, good. Tubing's nice and primed. No air bubbles or anything. I'm going to go ahead and grab my hook, my MAR, some extra alcohol swabs, and then I'm also going to draw, I don't need a flush because I'm actually going to be doing the piggyback, and then I will go into my patient's room. What I would do is I would take this and hang it lower since I'm going to be initiating Dilaudid. And then I would hang this higher. I'm going to stop this one and then connect my Dilaudid bag in the port closest to the patient. I'd clean off my ports. And then I would initiate the flow rate of 10 drops per minute for this one. Making sure that all my ports are open, everything's secured properly. Now go ahead and document in my MAR that I had the date, time, dosage, route, and how the patient tolerated everything. And then I would also put my initials, and then I would double check with the patient and make sure everything was flowing properly and that there was no perfusion and the site still remained intact. And that concludes my simulation.